far from taking responsibility or far from pinning responsibility on anyone, I think it's important to set out the procedure. So the procedure here is that there's a tender process. The tender process is an arm's length procedure where a board comes up with a decision based on all the documents that are in front of it. So that decision is then the decision on who the company is. So we then run with that decision. The company came to Gibraltar, they set up in Gibraltar, and we did think there was teething issues. But today, in the meeting that we've had, where we've mutually agreed to terminate, I think that we've accepted that they weren't prepared for some issues that have arisen as a matter of Gibraltarian culture. So I think that we've accepted today that that we weren't happy with the services they were providing, and they were struggling to cope.
Was the strike the final straw for you?
Well, we were aware that there was going to be a strike on Tuesday and Wednesday, and obviously that concerned us very much. We need to make sure that the 512 packages of care that we are provided without interruption to the service users. Throughout this entire process, the main concern has been the service user. We did have contingency plans in place were the strike to go ahead, but obviously the better option is for the strike to have been called off.
Minister, isn't it better to be transparent about what the issues were? People want to know that the problems have been dealt with or they will be dealt with moving forward.
I think that what the problems are is self-evident. I think that you just have to tune into social media to understand that there have been issues with consistency of care, with the carers turning up, with the rotas of the carers. So now that we're more than 6 months in, we would have expected these problems to have been alleviated by the company. But obviously they keep on persevering. So they are problems that are not going away and that keep on persisting. And therefore, as a result, we have said quite openly that we're not happy with the service that is being provided.
Does the government not take any responsibility, though? Because Lifecome Care says the salaries and the 0-hour contracts were passed on to them by the government, which has then created problems with the workers.
So bear in mind that the contracts were with ADA and MEDOC, who were previously providing the contracts. So we are legally obliged to 2P transfer. So it's called a transfer undertakings to 2P transfer the employees from their previous employee to the new employees. So the terms and conditions weren't conditions that the government set. The terms and conditions were terms and conditions which the previous employer set, and there were collective agreements in place between ADA and MEDOC and Unite the Union. So we made sure that that Lifecome undertook to provide the same terms and conditions that were previously in place with ADA and MEDOC. What we did ask Lifecome to do was to move away from the 0-hour contracts once they had set their rotas. And that was a commitment that Lifecome gave to us that they would be looking to do.
We heard Lifecome's CEO yesterday tell GBC that the government said that they weren't aware of the collective agreement, and if they had been aware, it would have been included in the contract. So would you say that that has been a major stumbling point here?
Well, yes and no, because the government were not involved in the collective agreement. The collective agreement is a collective agreement between a private company and Unite the Union. So the collective agreement was an agreement that had been in place that was then transferred over. And what had actually happened, what actually transpired after that was that when we became aware of certain differences that the collective agreement came, we stepped up and said to Lifecome, we will honour those terms that the agreements have for the employees.
Well, as Unite has said, this is an opportunity. So will the government be prepared to increase benefits to the workers moving forward and also perhaps eradicate the 0-hour contracts?
We are looking to move away where we can from 0-hour contracts. The issue with the carers in this instance is that the care that's being provided is sometimes not required because, for example, a user may move to a hospital or there may be different circumstances. So there has to be a certain flexibility. But what we have always argued is that there will be a bulk of carers that we can give fixed-term contracts to. We have to take on board whatever agreements have been signed by the previous company. So we have to honour the terms, or we have to make sure that any company that takes them on from now on honours the terms of the contracts that they have in place at the moment.
Moving on, can I ask you what lessons have been learned from this whole scenario?
I think that when looking to provide a service for the end user, we have to bear in mind that that we have to take into account cultural differences that we may have, that we have to take into account the Gibraltarian scenario in this context. And we very, very much have to look to provide the service that is needed for the service users and their needs. So we have to be on top of that service. So we have to have supervisors going around. We have to have some form of oversight of how the carers, or if the carers are turning up at their house, because ultimately, it's what I've said throughout, HMGOG and the care agency pays the company. So we've been paying Lifecome for the hours that the carers are contracted. And we need to have some oversight of whether that carer turns up at the house or otherwise. So we need to make sure that there are mechanisms in place so that we can make sure that the service user is receiving the care that we're providing for, that the care worker feels that we are supporting them in every which way that we can, and obviously that management is there to support the families and the carers.
Do you expect to have a new service provider in place within the next 30 days?
Yes, we do.
Have you already identified someone?
Yes, we are currently looking at different ways to set this up.
Was there a tender process?
We are, as you can imagine, we are currently in a rescue mode. So we're looking at different ways to set this up quickly.
So this is going directly to a company without having gone through the tender process?
Without obviating the tender rules, we're looking at different ways to set this up.
And can you at least tell us whether it's a company with a track record?
We hope that the individuals that run the company have a significant track record.
Have they worked in domiciliary care previously in Gibraltar?
Yes, they have.
Can you confirm whether it's MEDOC or ADA?
We are currently looking at all options, and we have to be very careful with the tender rules so that we don't breach them.
Finally, will the government be paying Lifecome Care any settlement or compensation fee as a result of the early termination of their contract?
The contract that we have entered into allows us to terminate with cause or without cause. So if we give the 30-day notice, we can terminate the contract without paying any compensation.
Okay. And finally, Minister, any guarantees to the service users?
Throughout this entire process, the reason that we've gone through this, the reason that we went out for tender in the first place, is to try and guarantee to the service user that the service that we are paying for will be received. We are providing 512 packages of care. We are extremely proud of the fact that we're providing 512 packages of care, and we want to make sure that actually the service that's being received is a service that we want the end user to receive. So what I would like to say is that we are working flat out to try and make sure that the service is received by those users.